Teniasis. Today we are talking about tapeworm infections in humans. People can get infections from adult tapeworms which acquired from eating raw or undercooked meat. Teniasis is a parasitic infection that occurs in humans due to the tapeworm species, Taenia saginata, or beef tapeworm, Taenia solium, or pork tapeworm, and Taenia asiatica, or Asian tapeworm. Humans are the only definitive hosts for these three species. Consumption of raw or undercooked beef, Taenia saginata, or pork, Taenia solium and Taenia asiatica, can result in infection with these tapeworms. Individuals with teniasis may be unaware they have a tapeworm infection due to the mild or non-existent symptoms. In many endemic areas where people and roaming pigs coexist, Taenia solium is responsible for 30% of epilepsy cases. It is thought to be responsible for up to 70% of epilepsy cases in high-risk communities. Incidence in humans. Taenia saginata and Taenia solium are found throughout the world. Taenia saginata infections occur worldwide, but are most prevalent in Eastern Europe, Russia, Eastern Africa, and Latin America. Teniasis caused by Taenia saginata can occur in areas where cattle and humans coexist in close proximity, and sanitation is inadequate, such as around feedlots, where cattle may come into contact with human feces. Tapeworm infections caused by Taenia solium are more prevalent in underdeveloped communities with inadequate sanitation, and where raw or undercooked pork is consumed. Latin America, Eastern Europe, Sub-Saharan Africa, India, and Asia have all seen higher rates of illness. Taenia asiatica is found only in Asia, with the majority of populations occurring in the Republic of Korea, China, Taiwan, Indonesia, and Thailand. In Thailand, a 2013 publication stated that teniasis is prevalent throughout the country, except in the south. Males were more frequently infected than females between the ages of 7 to 83 years. Taenia saginata is the most widespread species in the country. Recently in Thailand, there was a report of a tapeworm infection caused by routine raw beef consumption. Taenia eggs were detected in the feces of a 67-year-old male patient. Following medication, the patient defecates a 18-meter-long Taenia saginata, the longest tapeworm ever recorded in the country's 50-year history. His history revealed that he has been eating raw beef on a regular basis for more than 40 years. Life cycle of Taenia. Eggs or gravid proglottids are passed with feces. Proglottid is each segment in the strobila of a tapeworm, containing a complete sexually mature reproductive system. The eggs can survive for days to months in the environment. Cattle, as intermediate host of Taenia saginata, and pigs, as intermediate host of Taenia solium and Taenia asiatica, become infected by ingesting vegetation contaminated with eggs or gravid proglottids. In the animal's intestine, the oncospheres hatch, invade the intestinal wall, and migrate to the striated muscles, where they develop into cysticercine. A cysticercus can survive for several years in the animal. Humans become infected by ingesting raw or undercooked infected meat. In the human intestine, the cysticercus develops over 2 months into an adult tapeworm, which can survive for years. The adult tapeworms attach to the small intestine by their scolex, and reside in the small intestine. Taenia saginata tapeworms are usually 5 meters in length. However, it may reach up to 25 meters. The adult tapeworms produce 1,000 to 2,000 proglottids, and may produce up to 100,000 eggs per proglottid. Taenia solium, pork, tapeworms are 2 to 7 meters in length, produce an average of 1,000 proglottids, and may produce 50,000 eggs per proglottid. Taenia asiatica tapeworms range in size from 4 to 8 meters, produce 700 proglottids, and may produce 80,000 eggs per proglottid. Patients with Taenia saginata teniasis frequently exhibit more symptoms than those with Taenia solium or Taenia asiatica infections, owing to the Taenia saginata tapeworm's larger size, up to 10 meters, compared to the other two tapeworms, usually 3 meters. Tapeworms can cause abdominal pain, appetite loss, weight loss, and an upset stomach. Teniasis is most easily recognized by the active passage of proglottids, or tapeworm segments, through the anus and feces. Tapeworm segments can become lodged in the appendix, bile ducts, or pancreatic ducts in rare cases. Occasionally, appendicitis or cholangitis can result from migrating proglottids. Identification of eggs and proglottids in feces is diagnostic for teniasis. However, eggs and proglottids are not released into feces until approximately 2 to 3 months after the adult tapeworm establishes itself in the upper jejunum. Repeated examination and concentration techniques will increase the likelihood of detecting light infections. It is recommended to examine 3 stool samples collected on different days to increase the sensitivity of microscopic methods. Taenia eggs cannot be differentiated. However, if mature gravid proglottids, or, more rarely, examination of the scolex, are present, a species determination may be possible. Prevention and control. Praziquantel is the drug of choice for teniasis and should be given at a dose of 5 to 10 mg per kilogram orally once in adults, and 5 to 10 mg per kilogram orally once in children. The available evidence suggests that administering 10 mg per kilogram orally once may result in a higher cure rate than the 5 mg per kilogram dose. Albendazole 400 mg daily for 3 days is recommended as an alternative drug for teniasis. However, this is based on studies treating small numbers of infected individuals with Taenia solium or Taenia saginata. Stools should be re-examined for Taenia eggs 1 and 3 months after treatment to ensure complete clearance of the infection. Moreover, cooking meat and beef to an internal temperature of at least 63 degrees Celsius helps prevent teniasis. Teniasis occurs only when pork and beef are consumed raw or undercooked. Individuals who avoid raw or undercooked beef or pork are unlikely to get teniasis. In general, we cannot get tapeworm infections from our pets. The tapeworm that pet was diagnosed with is more than likely the flea tapeworm, Dipylidium caninum. Dog or cat tapeworm infections are a result of pet swallowing a parasite-contaminated flea. Only in very rare instances do humans accidentally swallow the contaminated fleas.